people who are joining us, Dr. Indu Poornima on Facebook Live, and some people may be joining us asynchronously later on. So let me first begin by extending a really a note of gratitude and a note of thank you to Dr. Poornima. She is super busy. She is a really renowned cardiologist practicing cardiologist at the Allegheny General Hospital. Dr. Poornima has received many accolades. She has been a fantastic spokeswoman for the American Heart Association and many other organizations. She is very passionate about what she does, which is cardiovascular health and wellness of all of us who are in the community. So I think thank you for what you do in addition to really what you do professionally as a cardiologist. So the outreach is really, really valuable. So I'm not going to read aloud all of your accomplishments, Dr. Poornima, but there are so many of them, and I think we have provided them to the people who are tuning in several formats. So let me first give you the forum here, and maybe you can tell us a little bit about yourself, just briefly, and then we can get into the real discussion on what we really want to talk about. So please go ahead.
Sounds good. Well, thank you first, Pradeep, for organizing this. I think this is an awesome event that you put together every year. And this is Heart Month. February is Heart Month. This is designated as Heart Month by the American Heart Association because we really want to get the message across that cardiovascular disease remains as the #1 killer of men and women in the United States and in many other parts of the world as well. So this is very timely, and I really appreciate you organizing this and getting the word across. Certainly, in addition to my daily job in terms of treating people with cardiovascular disease, one of my passions is really preventing the disease, such that we do not have to list patients for transplant. We do not have to put stents in coronary arteries and treat patients for congestive heart failure. Of course, that seems like a very utopian goal, but still no harm in trying to achieve it. So really, I'm glad that we are talking about cardiovascular prevention as one of the focus areas of the talk today.
Absolutely. And so, I think for people who have heard this, your thoughts, I think that's a very noble cause, what you do for the community in terms of prevention, so why get in trouble if you can prevent from getting in the trouble in the first place? And I think that approach is really something that I wholeheartedly no pun intended, but that's what I support. And for people, Dr. Poornima, who may not be as familiar with you, because we may have a lot of viewers who are outside the greater Pittsburgh area, but really just to summarize some of your key accomplishments is you are the director of the Preventive Cardiology and Women's Heart Center at Allegheny Health Network. You have been a quality officer for the Allegheny Health AHN, and you are actively engaged in a number of organizations. And some of your earlier training was from Stanley Medical College and University of Madras in India, followed by you did your residency in Penn State University near Detroit. And you have been really practicing. It's amazing. We have known each other for a long time, 22, 23 years, and you have been designated as one of the best doctors in the greater Pittsburgh area by the Pittsburgh Magazine. So you've done so much, and like I mentioned before, you're actively engaged with the American Heart Association. You've been the past president of its Pittsburgh chapter, and AHA, American Heart Association, does a lot in terms of kind of getting the message across in terms of what can we do about our heart health and so on. And in addition to, of course, your practicing cardiology, you have active faculty appointment through Drexel University College of Medicine. So again, I want to really convey my thanks to you on multiple fronts here for taking time to make this happen, right? So for Dr. Poornima, for our audience, right, I think this is the kind of fireside chat, and it's going to be a chat. It's not a lecture. It's not a seminar or a webinar, really. So we want to first, this is just the outline that we are going to follow here. We want to start with CVD, cardiovascular disease, in the big picture that you see. And then we'll kind of jump into, you and I have talked about this many times, as to how some things that you're born with, factors that we cannot control, such as genetics, gender, by and large, these are factors that are beyond us. So what is the, how do they play, how do they come in terms of heart disease, the incidence in men versus women, and then we'll kind of get into really, and ethnicity, genetics can play a major role. Then we'll get into the role of nutrition, which is where the bulk of this talk is going to be focused on. And then we'll get into the role of supplements, role of exercise, stress management, because all these things collectively affect our heart health. So let me ask you about what, Dr. Poornima, you see in terms of the overall trends when it comes to cardiovascular disease. And if you can also explain to our viewers, what does cardiovascular disease mean in terms of heart attack, heart arrest, congestive heart failure, and so on. So if you can take a few minutes, please, to explain that, the bigger picture, that would be great.
Sure. Yeah, so cardiovascular disease encompasses all sorts of conditions that result from issues that the heart itself consists of a muscle, but the heart muscle is supplied by arteries, which is a coronary arteries. Mm-hmm. In addition to that, the blood flow from the heart to the various portions of the body is regulated by what's called as cardiac valves. So issues can arise with the cardiac valves as well. And then there's 4 chambers in the heart. So the left ventricle is the muscular chamber that pumps the blood out of the heart into the various portions of the body. And that the various portions of the body get their blood flow through the arteries, which in turn arise from the aorta. So cardiovascular disease actually refers to issues that may arise in any of these portions. But the one we talk about most, of course, is what's called as a heart attack or a myocardial infarction. And what that means is a sudden blockage that arises in the coronary artery, which is the artery that supplies the heart muscle, as a result of which abruptly there's a decrease in blood flow to the heart muscle. And when the heart muscle dies, that's what is called a myocardial infarction or a heart attack. So when we use that term a little loosely in sort of the public sphere, but a heart attack or a myocardial infarction specifically refers to this condition. In addition to that, the heart muscle itself can fail for a number of reasons. And that is what is called as congestive heart failure, where the fluid then tends to, or the blood sort of backfills into the lungs, and patients become short of breath, they get swelling in their feet, and that is primarily due to a dysfunction of the heart muscle. Now, in addition to that, it's important to recognize that the heart muscle is very interestingly regulated by the electrical system of the heart. So the impulses that stimulate the heart muscle to contract and relax actually come from what's called as the electrical system of the heart. And that system can misfire. And I think that has been talked about much in the public sphere more recently because of Mr. Hamlin's cardiac arrest that occurred on the field and occurred quite suddenly. So that's what is called as a cardiac arrest. So when the heart basically fibrillates as a result of a dysfunction of the electrical system of the heart. Now, the electrical system of the heart can essentially develop a dysfunction due to a heart attack, but can also occur independently. And in his case, we believe that it wasn't really a heart attack that caused this, but it was an actual problem with the electrical system itself. Another common electrical problem that I think many may be familiar with or aware of is what's called as atrial fibrillation. So there's a top chamber of the heart, which are the atria, and the bottom chamber, which are the ventricles. So the ventricle, when it fibrillates, is what causes a cardiac arrest. But when the atria fibrillate, all that you may have is just palpitations. You may not it may not result in a very dire, have any dire consequences immediately, but over a period of time, it can cause problems.
Yeah, yeah, and absolutely. And I'm glad you explained, like, as an engineer, I'm an engineer by training, right? And when I think about heart, right, I think is one of the most amazing, most energy efficient mechanical pump, but it also has a very sophisticated electrical signaling system, that makes that pump work. And it has to work all the time, right? It has to work. And I think in a day, probably our hearts pump close to a few thousand gallons of blood. And it has to beat continuously. So it is simply amazing. But I'm glad you mentioned the differences between how there could be a potential electrical malfunction between the signaling between the heart, different parts of the heart, that can cause, in this case, it could have been the hit, so commotio cordis, or it could have been something else. And about 1%, you mentioned arrhythmia, is about 1% of the US population has some form of arrhythmia. And you explained that just because you have arrhythmia doesn't mean it's fatal, but it needs to be, that's when you will see a cardiologist and they can detect it and they can figure out what interventions might be needed for this kind of thing. Fantastic. So let me come back to these 5 things, and I would like Dr. Poornima to talk to our viewers about what these means and why they are important, especially we're going to dive into nutrition a little bit deeper, but kind of to set the stage. If you don't mind, please kind of describe what these are. So A1C, blood pressure, cholesterol, triglycerides, and the waist circumference.
Yeah, so in terms of the heart attacks occur because of a process called atherosclerosis, or plaque development in the arteries. And that occurs over a lifetime, honestly. It's not something that happens suddenly. So we know that even children can develop plaque or atherosclerosis if they do have cardiovascular risk factors. And these risk factors are the ones you had sort of enumerated there, and include starting with glucose, which is essentially measured in the form of a hemoglobin A1C, and that is what is the A. So diabetes is one of the biggest risk factor for cardiovascular disease. And the next would be a high blood pressure, and that is your B. C, which is cholesterol. And cholesterol can be further broken down into what is called as LDL, or the low density lipoprotein cholesterol, and triglycerides. And these are the 2 components of the cholesterol that are important. And I'm sure we'll be talking a little bit more detail about that in a little bit. But in general, cholesterol, diabetes, high blood pressure, and then, of course, your overall body habitus, which can be measured in the form of BMI, weight, but more specifically in the form of waist circumference. And the W to H ratio is really your waist to hip ratio. So it's not important to just look at just weight or BMI, but it's also important to look at the waist to hip ratio, because we now know that accumulation of fat, predominantly in the abdomen, which actually leads to an abnormal waist to hip ratio, is actually more problematic than being overall obese. And there are certain populations where this happens more so, and specifically South Asians are prone to this. So accumulating fat around the waist area is not only a future cardiovascular risk, but in turn promotes what's called as insulin resistance, which ultimately leads on to diabetes. So
Absolutely.
that's definitely something to also think about. I mean, one of
Mhm.
the other factors that wasn't listed there, the relation to nutrition, but obviously needs to be thought of is smoking.
Mm.
And smoking, in addition to all of those other risk factors, is one of the main causes of the increased cardiovascular issues that we are seeing in Southeast Asia in general, as well as in the Middle East.
Absolutely. No, this is so important. And I think I'm just citing here a couple of things here, which was the so-called masala study that was conducted, I think nationwide, probably, but starting in San Francisco. And then, uh, and also, can you talk about uh, a couple of other things, which is the symptoms as well as the onset of any kind of cardiovascular problems. There are some differences between men and women, right? So in terms of gender differences, and very often uh, the uh, uh, women do not seek the kind of help, or they don't check themselves and they dismiss certain symptoms that they should not be, right? So can you please talk about more specifically about heart disease in women versus men, and that it is, what are some of the highlights? What do you think of that?
Yeah. No, that's a great question. And again, being that it's Heart Month, the main reason for February being designated as Heart Month is, in fact, to raise the awareness that cardiovascular disease is indeed the number one killer of women in the United States. And I think women are obviously very aware of breast cancer being a big issue to be screened for and taken care of, but heart disease is not something that comes to most women. That's not something that they think about as something that they need to work on to prevent. But in terms of risk factors, so women, really all of the risk factors that we talked about, smoking, high blood pressure, diabetes, weight, cholesterol, pertain to men and women equally. But in addition to that, women have some unique risk factors, and those are coming to light. I think more recently we have become aware of that. And some of these include pregnancy related complications. So a woman who develops high blood pressure during pregnancy and has what is called as preeclampsia or gestational diabetes or gestational hypertension, we are now finding out that these women are at risk for future cardiovascular disease in the form of heart attacks, heart failure, as well as strokes. And believe it or not, cardiovascular disease is the number one cause of maternal mortality in the United States. And in the United States actually has the highest maternal mortality compared to all other developed nations. And so important to seek the advice of a cardiologist as well as your obstetrician and gynecologist if you do have any of these issues during pregnancy. There are also some other unique conditions such as polycystic ovarian disease, which occurs and is diagnosed in young women, autoimmune conditions such as rheumatoid arthritis, lupus, which are actually more common in women than men. All of these predispose to cardiovascular disease in women, and something to be aware of. But in terms of the symptoms itself, you're absolutely right, because women don't always present with the crushing chest pain or in the middle of the chest. Typically do not have symptoms that radiate to the arm, that is, again, classically described as angina, but very often have symptoms such as shortness of breath. That is unusual. They can have symptoms such as jaw pain or neck pain. Upper back pain is not uncommon. So I think what I advise women in general when I speak about this topic and when I see patients is that if you have any unusual symptoms, especially that come on with activity and that are anywhere in that upper chest area, or that you have problems with shortness of breath that occurs subtly, that is something that requires attention. And do not make your own self-diagnosis. Make sure you speak to a physician before you decide whether this is related to your heart or something else.
That no, this is very, very valuable, advice and information. And I forgot to mention earlier on is, please make sure these discussions we have are not. Dr. Poornima has not seen any one of you personally, so this is not to be treated as medical advice, but general information that you should definitely bring up with your own physician, your own medical team, and then act on it depending upon what their recommendations might be, right? So one more thing I wanted to ask you, which is, and you did mention about blood pressure and pregnancy. Some of these things, right, they don't affect all populations equally. In other words, for example, I just read a couple of weeks back about how African American women, where more or less kind of a lot of them are uh, dismissed in the sense saying, oh, blood pressure, don't worry about it. And so you mentioned something very important there that, follow this up with your primary care doctor, follow this up with your cardiologist, just bring it up. I think so. Patients need to be their own advocates, or if you're a family member, is that what you kind of think as well?
Yes, definitely. I think the more awareness you have, the more questions you ask. I think you are definitely. I look at healthcare as co-production. It's not just the physician alone. It really needs to be a two-way street. And certainly, speak to your doctor, ask the right questions. But first of all, be aware that this is not a problem that goes away just after you deliver, especially women who develop high blood pressure during pregnancy. We do see a higher incidence in Blacks compared to other races. And therefore, those women especially need to be vigilant about this condition.
Yeah.
I also wanted to mention that we think there is a rise in these conditions, such as high blood pressure during pregnancy, as well as gestational diabetes, due to the increased maternal age. Women come into pregnancy at an older age. In addition, women coming into pregnancy already have multiple cardiovascular risk factors. So they're overweight, they could be smoking, maybe they have mild high blood pressure. And infertility treatments actually also increases the likelihood of these conditions. So I think we are dealing with a sort of different set of population now, and that may be the reason we are seeing a higher incidence of these problems.
Correct.
And I know you had earlier shown the slide on vascular age. If you want to bring that back up, that's an important concept to get across, because a person may be at age 20, but if they have plaque in their arteries, their vascular age, as we call it, is different compared to their real age. On the other hand, I have seen 60 and 70-year-olds who are extremely fit, who've eaten healthy all their lives, never smoked, and of course don't have any genetic or family history, and their arteries look squeaky clean. So it can go both ways. And so that's what it's important to consider. And that's a concept we are even trying to get the medical community to embrace, because just based on age, you cannot say, oh, 30-year-old, I don't think you're going to have a heart attack, so just go home and this is probably reflux. So even a 30-year-old could have a heart attack if they have all the risk factors that could be supporting that.
Yeah, absolutely. And that's why, this whole notion of, how old are your arteries, right? Or what's your vascular age? It's not just the chronological or biological age, but really the vascular age. And some of these things are measurable. And I think if I remember it right, Dr. Poornima, what you had mentioned is you kind of see this incidence, even though it's a smaller number, but you do see a very clear shift almost by 10 years in terms of what is the population, what kind of age group, chronological age group that you begin to see heart attacks, right? So 30-year-olds, 40-year-old, 50-year-old. This is not an older person's disease per se, right? That's what I think you're trying to say.
Yes, and one of the troubling statistic around the world, and including the US right now, is that the incidence of heart attacks, we've made great sort of progress in terms of decreasing the incidence of heart attacks actually in the older age group. But we are seeing a troubling trend in the rate of rise, especially in young women, actually. Both young women and men, certain races, more so Black, South Asians. And I think all of us are aware, even in our respective communities, that it is not uncommon to hear of a 40-year-old developing a heart attack. And the unfortunate part is when the young patient develops a heart attack, the likelihood of that being fatal is way higher than if an 80-year-old develops a heart attack.
Now, this is very important, and the points you made are very critical in terms of some things we cannot control, right? In terms of the genetics or the genetic predisposition to, for example, having belly fat and so on. But a lot of these things that you see here, and I haven't listed smoking here, you're absolutely correct. And I haven't listed stress, that's another modifier. So these things are modifiable, right? You can actually change what you eat, right? Exercise, sleep, managing stress. So there are things that you can definitely modify in your own lifestyle, right? And it's not like it is what it is. You don't have to accept it like that, right? So that's the kind of the prevention side of things, right? So let's talk a little bit about what we really want to discuss here is what kinds of things can we do in terms of nutrition. We'll come to physical activity a little bit later, but really let's start with some very simple questions, right? So most people know that trans fats, those things are not good. Eating too much of fried food is not good. So can you explain in your own experience, in your own kitchen, at your own home, what do you do in terms of cooking oils? You have coconut oil, avocado oil, olive oil, you name it. So you tell us what you think about cooking oils.
Yeah, certainly there's a lot of discussion about cooking oils, or there has been a lot of discussion over the years. And, depending on which group is louder, certain seem better than the others. But in general, I think what you need to pay attention to is buy the cooking oil that has the most unsaturated fat, and preferably what's called as polyunsaturated fat. And the oils that typically conform to that are canola oil, olive oil, certainly avocado oil also falls under that. But things we want to avoid are palm oil, coconut oil, lard. Those are the things that have a very high saturated fat. And so that's really the distinction you need to make. And I would say in terms of nutrition in general, I think the first concept is to start to read food labels. I think that's what I do with all my patients, is spend even like 5 to 10 minutes just educating them on how to read food labels. And that goes a long way, because it sort of makes you start thinking, when I go to the grocery store, that's the first thing I'm going to look at versus what brand or what it is, because that tells you a lot. So, and I think at least in the US, the food labels do distinguish between saturated and unsaturated fat. So you should be able to pick that up.
Yeah, no, this is very important, and so many things in terms of food labels we can learn if we pay a little bit of attention. And once you kind of get a hang of it, then you don't have to do this again and again, right? I mean, so once you know what kinds of, for example, olive oil or canola oil, you kind of just make that as your default choice, right? So you mentioned lard, and a lot of times, even though I personally don't think we should ban any type of food, meaning what we eat, because that's not sustainable in the long run. But there are differences. Like, for example, eating fried food at home is a little different from eating out and eating fried food, right? Because they have deep fryers, the oil. So what's your take on eating out versus eating at home?
Yeah. Well, it's always a challenge, right? We are all in we have very busy lives, and so it's not uncommon that, and also just to get a little, I guess, time out, you tend to eat out,
Relocation.
but make good choices, make healthy choices. In general, decrease the amount of fried food, whether it's at home or whether it's outside, I would say. Keep it as a treat rather than as a regular event. I think one other thing I would like to mention about oils here, and specifically pertaining to the South Asian diet and not uncommon in restaurant food, is use of refried oil, which is the worst because the oxidized, I mean, you can take canola oil, and once you oxidize it, it has the same adverse outcomes as eating lard. So I think refried oil is one thing if you can avoid, and I think that's the challenge when you eat fried food outside, especially in some South Asian restaurants where it is commonly used. And at
Absolutely.
home, there should be no reason to use refried oil. And there are some studies which have shown that it's almost equivalent to eating saturated fat on a daily basis.
Absolutely. And again, as an engineer, right, when I think about this, we have oils that we use in car engines, right? And the reason why we change that oil every few thousand miles or every few months is because that oil starts as a low viscosity thing, and then as it heats up, it becomes polymerized, it becomes thick, it becomes gel, and that's in a way what we do when we deep fry time and over again in the same oil, right? So when you eat out, there are a couple of things happening. One is we have no idea what are some of the other things that go into the food. And then this risk of seemingly taking a healthier oil and really converting it into something that it is not just the processing that the oil goes through. So let's turn our attention a little bit to, I don't really personally like the word diet because it tells me, it's something that's not sustainable, but be that as it may, let's talk about Mediterranean diet, and because that has been shown or at least touted to be very beneficial in terms of cardiovascular health. So what are your thoughts on Mediterranean diet or food choices?
Yeah, so I think the Mediterranean diet does a good job in trying to compile all the different food groups in appropriate portions. It just happens to be called that. I think this is sort of what we've been advising over the years, but it's easy to give advice to a patient saying, okay, follow this particular diet, because really all that it is maximize fruits and vegetables, use whole grains, use nuts, minimize the amount of animal protein, and seafood, of course, is reasonable, and decrease the amount of saturated fat use. So it just so happens that in the Mediterranean area, this diet is followed even on a daily basis, even before a physician told them to do so. So it just got adopted as such. And also, among all the studies that have been done, I would say the Mediterranean diet has been studied the best and shown to really decrease the amount of cardiovascular disease related deaths as well as heart attacks. But in addition to that, has shown great progress in terms of reducing cancers. So it's not just cardiovascular disease, but it also affects other conditions.
Absolutely. And this is the other thing, right? So in reality, a regular person like me, we don't get up and we don't say, well, this is what I'm going to do to eat, that's good for my heart. And then this is what I'm going to eat for my bones and, muscles or my brain. We eat only 3 or 4 meals a day. And so I think what you're also pointing out is a lot of these things have benefits that are not just cardiovascular, but they could be for many, many other things. The other thing that I'm going to ask you is the so-called DASH diet, which is the dietary approaches to stopping hypertension. So that's like a low sodium kind of approach. So can you please talk about this as it relates both to maybe diabetes as well as heart health?
Yeah, so the DASH diet is actually not very different compared to the Mediterranean diet. I think they all have the basis of more fruits and vegetables, whole grains, less, animal protein. The other focus, of course, in this diet was the amount of sodium intake.
Mhm.
And the DASH diet typically talks about reducing sodium intake to about 2,000 milligrams a day. So I think there are some versions of DASH that have gone up to 3,000, but the initial studies were based on 2,000. It is very hard to implement the 2,000 milligrams. I think once you start reading food labels, you'll understand how much sodium is there in everything that you eat or drink, including milk has sodium. So I think, you can take all the components of the DASH diet, but you can relax the sodium intake to about maybe 3 to 4 grams even, or that is reasonable. But important to consider that especially among Indians, the average sodium intake has been studied and shown to be about 8 to 10 grams a day, which is a lot. So even if you can cut it by half or 1/3, I think that will significantly improve or reduce your risk of high blood pressure. And the main thing with sodium is higher the sodium consumption, or communities that have a high sodium consumption typically have a higher incidence of high blood pressure. And that's where this data comes from.
Absolutely. Because sodium likes to, it's salt, most people know in simple terms, if you have humidity, salt picks up water. And that's what happens to the sodium ions when if you intake salt, sodium in form of sodium chloride, that's what increases the overall volume of blood pressure goes up. That puts more stress in the heart as well. And you're absolutely right. 75 to 80% of the sodium comes from processed food. So it's not necessarily what you have as a salt shaker on your table. It's already there. If you look at some of the condiments, very, very high in sodium. So I think you're absolutely right about that. Let me make sure I'm just checking my notes, making sure we're not leaving out. And please chime in if we are missing out on something that we should be talking about. So in general, looking at, if you kind of stick with whole foods, mostly plant-based foods, and not processed foods, those would be good for both cardiovascular and overall health. Is that what are your thoughts on that?
Yes, 100%. I think more home cooking, less processed foods, it doesn't have to be a complete vegetarian diet, but if you are introducing animal protein, make sure it's lean protein, make sure it's seafood, of course, is preferred. I think the main messages to get across. And
Correct.
Even if you are adopting a primarily vegetarian diet, I think there's plenty of evidence that you can get the adequate amount of protein with several different forms of protein intake of nuts, legumes, and of course, if you consume dairy, that also adds to that. So it is possible, regardless of what sort of general dietary pattern you have, if you can just adopt some of these principles. But I think it's all about mindfulness, being mindful about what you eat. This whole concept of food as medicine is something that we really need to get across, because among all the medications that you take, if you can just regulate your diet, perhaps you may not have to take as much.
And it's interesting you say that food as medicine, that's a very powerful concept. And the way I kind of look at it is, I would much rather have food as medicine now rather than having medicine as food later in my life, right? I don't want to have so many medicines that they, it's overwhelming. No, this is really great. So let me turn to a few other things that are, I think, very important, that always make news one way or the other. So what do you think is the role in terms of supplements? Not all supplements are necessarily bad, but let's start with the ones where uh, there is some of these things are in the news. So the so-called go low supplement or similar other, we're not just picking on one or the two, but what is your general advice in terms of people just trying something? Everybody wants like a magic pill supplement. So what are your thoughts on some of the supplements that we see being advertised or being talked about?
Yeah, great question. Um, so I don't think any kind of what I would call these as fad diets are sustainable. They may cause an immediate weight loss, but I do not think they are very sustainable. That's one. And the second point is some of these supplements are have first of all, none of the supplements are studied in a rigorous fashion. They do not need FDA approval and therefore do not go through any sort of regulatory process. And then finally, they may have ingredients which we don't even know what they do. And many of them have stimulants. Most of the weight loss supplements have stimulants. Stimulants can cause raise in heart rate, can increase your blood pressure. So if you're already prone for some of these conditions, you may actually end up having adverse effects from these supplements that are undesirable. So that is definitely my take on supplements in general. If you, again, eat a wholesome, healthy diet, you probably don't even need a multivitamin. And this question has been studied and shown in really large populations that multivitamins really don't do anything. And if you eat a healthy diet, you do not need to take a vitamin every day. Now, certain vitamins, I think genetically and because of where you live, you may be deficient in, such as vitamin D, very common, especially in a vegetarian diet. And if you live in Pittsburgh with lots of gray days, to be deficient in it. So it's not unreasonable to go on a supplement at that point. But always check your levels, talk to your doctors. Calcium is another thing that is very commonly used sort of over the counter. And women tend to think that the more calcium, the better. And that may not actually be true. If your calcium levels are fine, taking in an additional supplement really doesn't make any difference. So, yeah, in general, I don't think there's much role for supplements in somebody who's eating a healthy diet. I think you have omega-3s there. I think the amount of money that is spent on supplements in the US is quite amazing. And the benefit is very, very questionable. So if you take the omega-3s in its natural form, which is in seafood, I think that's where the benefit is. So when something is formulated in the form of a pill, it may not have the exact same effects as taking it in the natural form. And that's another, it also pertains to things like turmeric. I think that seems to be the hot rage now, taking the turmeric pill as opposed to using it in your diet. So in general, taking it in the natural form is definitely better compared to taking it in a pill form. That would be my take on things.
No, I'm so glad you mentioned this. And so, if I think people really think they need a supplement, somebody who does think they need a vitamin D or calcium to prevent, osteoporosis down the road, the best thing really for them to do is really consult a physician, consult their primary care doctor, consult their cardiologist, and then kind of decide, as opposed to just kind of, I read somebody's taking it, so I'm going to go for it. And the other point, Dr. Poornima, that you mentioned, which I had forgotten about, was really the role of energy drinks, right? Because they tend to be mostly very high in caffeine, right? So I think you mentioned some of the potential risks in terms of heart health as well as overall health with some of the energy drinks that we see. So, and there are, as you mentioned, there are good reasons. For example, folic acid supplements for pregnant women, B12 if you are overly concerned about people who are vegetarian, and but I think best thing to do is really talk to your primary care doctor or talk to somebody who knows what they are doing, and just don't go by what you see on TikTok or Facebook or and that's not to downgrade any of these platforms, but it's really don't just listen to random people claiming to be experts. Wonderful. So let's come to a couple of other things. I think you did a great job of covering in terms of nutrition, in terms of the role of different fats, oils, sodium, supplements, and so on. Let's come to the importance of staying active. This kind of goes back into yeah, please.
Yeah, just one thing I just wanted to add in terms of nutrition is very often when people go on a low-fat diet, they substitute that with refined carbohydrates. And I think we have seen in the US, that's basically what's happened. When they said eggs are bad and fat is bad, everything was substituted by refined carbohydrates, which has led to the epidemic in diabetes. And I think the same is happening in many other parts of the world as well. But at an individual level, make sure that if you are embarking on a weight loss regimen where the fat is decreased, the substitution should not be with refined carbohydrates.
Yeah, no, this has always amazed me as to how like so many people, and even this actually came from some very renowned nutrition schools in the US, including Harvard, where they kind of pushed for this low fat thing without really kind of thinking about, okay, if the fat goes away, then what's being added to this, right? And mostly it was all mostly sugar, right? So low fat doesn't always mean it's automatically healthy, right? So I think that's your message. Very good. So turning to physical activity, exercise, what's your take on some of this in terms of how it affects our heart health?
Yeah. Well, certainly get moving. That's the message to get across. Exercise, the American Heart Association does a survey of exercise habits in the US, and less than 25% of the US population actually meets the guidelines for physical activity. And physical activity, so this is a nice slide. It tells you what would be considered as exercise. But the basic thing to remember is you want to include about 150 minutes is a basic minimum for cardiovascular health, at least. That has been studied and proven. So it can be broken down as 30 minutes 5 times a week, or a longer time in a shorter number of days. But minimum of 150 minutes. It should ideally include a combination of aerobic as well as strength training, because strength training has its own sort of beneficial effects in terms of how the body utilizes carbohydrates and fats. But again, as you have included here, this is not just for cardiovascular health. It has a lot of other beneficial effects, including your mood, in addition to many other conditions.
Absolutely. There are so many so-called brain-derived, neuro factors, BDNF, that are released as a result of any kind of physical activity. And I think the point here is, and I'm a certified personal trainer through the American Council for Exercise, and I can tell you that it's not about hitting the gym, right? You can be gardening, you can be walking, golfing, tennis, swimming, anything that we enjoy, that's the right exercise for you. It doesn't have to be spending hours and hours in the gym. If you don't
Yeah.
enjoy it, that's not a good exercise for you. And
Yeah, and I think thanks to the pandemic and working from home, we've certainly propagated what's called as a sitting disease, cardiovascular disease. And I tell patients, even in winter, if you live in a two-story home, just walk up and down the steps about 5 times, get your heart rate up in between meetings and things like that. I mean, you just have to get creative, what works for you. You can do a high intensity workout in 15 minutes and get your heart rate. The goal is to get your heart rate up for at least a sufficient period of time, and that even after you stop it exercising, the effect of that would still be there.
absolutely. And, as you mentioned, strength training has many other benefits in terms of lowering your risk for falls, better balance, lowering the risk associated with osteoporosis, which is very important, especially in postmenopausal women. And there are a lot of other benefits in terms of not only physical benefits, but also benefits in terms of managing your stress levels, lowering your stress levels. So let me turn to some of that in the few minutes that we have. Um, Everybody is very aware, or I think say most people are very aware of the mental health crisis that we see. It's another kind of pandemic that actually started way before COVID-19 started in the US. And a lot of people feel anxious. We heard about some of prominent politicians and Hollywood actors and actresses, and just our friends and family talk about being anxious, feeling depressed, and chronic stress. So, how does that play into having a deleterious effect on cardiovascular health?
Yeah, unfortunately, stress and anxiety, all of that has direct effects on cardiovascular health. Um, it releases the hormones that are typically associated with stress, what are called as the stress hormones. And those hormones actually lead to constriction of the arteries, which in turn raises your blood pressure, can raise your heart rate. And over a period of time, this can lead to high blood pressure, which in turn can increase your risk of heart attack, stroke, all of those. There are some specific forms of stress that are common, or not forms of stress, but specific effects of stress in women. Women can tend to develop an acute congestive heart failure episode when they go through an intense amount of stress. And the heart function can go from completely normal to like 10% of normal in a few minutes to hours. So stress is an important factor, and sleep sort of plays into this as well. The American Heart Association has something called the Life Simple 8. It used to be Simple 7, which is all the things we talked about before: cholesterol, diabetes, high blood pressure, physical activity, diet. But last year, sleep was added to that, with the recognition that lack of adequate sleep certainly perpetuates all of these other risk factors, including diabetes, including high blood pressure. So ways to manage stress is something. I do not think there is one, magic bullet for that. I think each one has to figure out what works for them the best. But it's also important to keep in mind that is something to think about. It cannot be measured like your blood pressure or your blood sugar, but it's still, you should be able to tell that, yes, I'm under stress, and therefore find a solution for it.
Yeah, absolutely. And I think you rightfully said that we can measure blood pressure. You can measure, HDL, LDL. You can measure a number of other. You can take an ECG, but stress is something that is not quantifiable, and you cannot just prescribe a medication and just say, this is what you do. Everybody's situation is different. But I believe, tell me what you think about some of the simple things, so exercise, physical activity, we know it has a huge effect on lowering stress, in addition to the physical benefits. But what about, what's your take on some of the, essentially what I would say are zero cost interventions, which is, which have to do with mindfulness, meditation. What's your take on that in terms of managing stress?
Works really well, and it's easy to do. I think simple breathing exercises, we know that it can reduce the heart rate, it can reduce the blood pressure. In fact, it's not uncommon that as a patient walks into the office and the initial blood pressure check is high, you let them wait for a couple minutes, take some deep breaths, and you check it again and it's low. So it clearly tells you that a simple thing like that can have an impact on your body activities.
And just some of these things are far simpler than what people think. There is no
Yeah.
religious undertone to a lot of these things with respect to deep breathing, right? Meditation. You can kind of just do it, and there are a number of places one can go to learn. Even online, there are some really good places. And just the fact that you mentioned that these things can happen time and again, and that's what we don't kind of quickly grasp, that that's having a deleterious effect on your heart health, right? And what you mentioned, white coat hypertension, right? People want to see a doctor, the blood pressure goes up, and that happens in different settings. You are going to be in an office, there might be a meeting where something important is, your blood pressure could go up, you might feel anxious. So there are different ways to really effectively deal with it. And again, people can always talk to their primary care doctor and figure out, and kind of just letting people know goes a long way, I think. Fantastic. So we are almost, it's on, almost on the hour here. Time goes by. I want to again thank you for bringing this, making yourself available for this conversation. That's really greatly appreciated. I just want to remind people who might be watching this or seeing this later on, we have another fireside chat with Dr. Mayura Ginde. She is based in Pittsburgh. She will be talking about dental and oral hygiene and oral health. And again, that Dr. Poornima, has been again tied into heart health, because it's all kind of inflammation in various forms that we see in our bodies. So just kind of in terms of summarizing what we talked about, right? We talked about a number of different things, but starting with the bigger picture, ethnicity, genetics, gender differences, role of nutrition, role of supplements, stress management, sleep, role of physical activity, exercise, a number of things we covered. So I really want to thank you for giving us a very comprehensive take on heart health. It's not a coincidence that we had the fortune of having you here right after Valentine's Day. So, so there's a reason for that, and so I want to ask you, in conclusion, what is your take-home message? What should people think about? What are some of the things that you would want to share with people as a take-home message?
Well, first of all, thanks for having me, and thanks for organizing this. I think what you're doing is immensely helpful. I'm sure even if it touches one person and they make a change, that goes a long way. So in terms of, the message to get across, the most important thing is that heart disease is preventable. Even if you have the genetics for it, if not anything else, you can delay the onset. And that is by being proactive about your health, knowing what are your risk factors, talking to your physician about it, especially if you have a strong family history. talk about it to your physician at age 20. Don't wait till you're 40 years old to figure out that your cholesterol has been high for the last 20 years. So start early, know your risk, and know that it is preventable. And lastly, I'd like to make a pitch for bystander CPR, which I think was so important in Hamlin's survival, especially the fact that he's made a full neurological recovery. So bystander CPR, I think every person should try to learn. You never know when your loved one will have a cardiac arrest. Hopefully it'll be never, but if it does, you're there for them. And every minute counts in terms of a cardiac arrest, every second counts. And so the sooner you can start that CPR and administer it effectively, the likelihood of neurological recovery is much, much higher.
Absolutely.
So just make a pitch for that as well.
Oh, absolutely. And that's something I should have brought this up earlier on in our discussion. And, even simple things like being your own advocate, like talking to your schools to figure out, do they have enough AEDs? Do they have enough people? Most of the athletic trainers are trained, but is that actually the case? How far in your office is the automatic, defibrillator? It should be within 2 minutes access. Even 2 minutes could be long, but realistically, are those things available at your schools, in your offices? If they are there, being aware where they are. So those kinds of things, I think, can make a real difference. They can absolutely. And then for you to be able to use or learn how to do CPR nowadays, and you can correct me if I'm wrong, you don't have to do what was called as mouth-to-mouth resuscitation. So that's another thing you might want to tell people. Maybe you can just quickly tell people what exactly is involved when we do a CPR, with chest compressions.
Yeah, so with CPR, as you said, that right now CPR, especially bystander CPR, just involves chest compressions. And just knowing how to do effective chest compressions and at what sort of interval speed is important. And the song Staying Alive, it's an old song. So the Heart Association, whenever we teach people CPR, that's the song we play. And as long as you keep up your compressions with that, that's all you need to do. But the effect of CPR is that the blood that is remaining inside the heart cavity is actually being pumped to the brain, most importantly, during that entire period of cardiac arrest till a defibrillator can come and the patient can be resuscitated. So just those 2 minutes are so important.
They're absolutely important. And, as a musician, right, I think if you just kind of, I'm into music too, and, just it's pretty intense. I mean, you have to work pretty hard to, it's not, so that's wonderful. So thank you for, being a strong advocate, not only for CPR and AEDs and so on. I think you've been an amazing ambassador for all of us in terms of promoting, taking time from your very busy schedule, from your family. So again, I want to thank you again. I'm going to make sure we take you out for dinner or something like that. So we'll definitely do that. But again, thank you, and thanks to all our people who will be watching this today and maybe later on. So stay healthy, stay well, stay active, and keep moving. Okay. Thank you, Dr.
Pradeep. Have a good afternoon. Bye-bye.
Thank you. Bye-bye.